All right, good afternoon, everyone joining us in on your lunch hour here. Maybe you just had lunch. I'm WPTV senior reporter Michelle Casada, and joining me today is Dr. Dudley Brown, OBGYN with the Brown Institute and Wellness Center. And Dr. Brown, we're talking about a very important topic, pregnancy and the COVID variants out there and the vaccine. I know we have done many stories on this. We've talked about it. I know there's been a lot of information that we've learned over time with COVID-19. So first, I wanted to welcome you, Dr. Brown. Thank you so much for taking your time to be with us.
Thanks for having me. Happy to do it.
Awesome. And for all of you viewers out there, anyone who has questions about this topic, please feel free to comment those and we'll be pulling them up during the discussion. I want to first run a story that we aired a couple of weeks ago on a local mother who had COVID while she was pregnant, and she kind of recounts her story dealing with the virus while she was pregnant. So we'll go ahead and air that first to kick off the discussion.
Okay.
You want a bottle?
At 41 years old,
The second she sees my face, she just lights up. I love her.
Kenya Traska,
Yeah, she's 3 months.
a mom of 3 boys, never expected to find herself pregnant again.
Scary. But I was happy when I found out it was a girl.
In the middle of a pandemic at 5 months
I
pregnant,
laid down in bed and it was like I felt like I had arthritis. Like every joint in my body, every muscle in my body was so sore. It was like I got hit by a bus.
Kenya tested positive for COVID-19.
I had gone to Wellington Regional because my fever hit up to like 104.3, which, you're not supposed to have a high fever when you're pregnant.
At the time, very little was known about pregnancy and COVID-19.
Yeah.
That worried Kenya, especially when she became a long hauler.
Even after I tested negative, I was still very symptomatic. It actually got worse. So I'm like, how am I negative now, but I'm feeling even worse?
Bronchitis, acute pneumonia in one of her lungs, Kenya said she was in bad shape.
Oh, don't cry.
But her baby girl was safe and snug in every ultrasound.
She was like protected in the womb.
The baby was born healthy, weighing 7 pounds and 13 ounces, and with COVID-19 antibodies.
All of a sudden when I saw her, we named her Princess Leia because Leia means God's gift. And Lene, which is her middle name, Leia Lene means God's grace.
Kenya still can't fully smell or taste months later, but she got the COVID-19
I
vaccine.
want to keep her safe for sure. I don't want her to get it. She has antibodies, but there's no vaccine for babies yet.
And so she wrote to us to introduce us to her sunshine baby.
It's like a miracle. She just brought so much sunshine.
To the world, she is a precious baby. To me, she is my entire world. It was these last words in her email that made us dig a little deeper to meet a princess.
Hi.
Michelle Casada, WPTV, News Channel 5.
All right, and there you saw Kenya Traska's story. She talked to us a couple weeks ago, and as you heard, she did eventually get the COVID-19 vaccine after delivery. So one of the first questions, again, just reminding everybody, we're talking with Dr. Dudley Brown with the Brown Institute for Health and Wellness. And one of the first questions already, Frank is asking, how dangerous is it for a pregnant woman to get the vaccine? So I guess we'll kick it off there first with the vaccine. Go ahead, Dr. Brown.
It's not dangerous at all for a pregnant woman to get the vaccine. The vaccine side effects, typical side effects of injection site reaction, low-grade fever, fatigue, which are all sort of mild and self-limiting, are not dangerous to pregnancy. So there really is no danger in a pregnant woman getting the vaccine.
And Dr. Brown, following that, Katie Smith had a question too. She says her daughter-in-law is 4 months pregnant. She's already had her second COVID shot while she was at 3 months pregnant. And Katie's concerned. She wants to know if there's any effects that can happen to her grandchild, or is there any need to worry?
So sort of, we'll get this theme a lot with the questions, I suspect. So with the first question and this question, the questions are framed in a way of trying to clarify the danger of the vaccine, which those are fair questions. To answer a question with a question, and clearly I'll answer it otherwise as well, the real danger here is COVID. So COVID is more dangerous to get COVID in pregnancy than it is to get the vaccine in pregnancy. It is more dangerous to get COVID in pregnancy for your granddaughter, for your daughter-in-law and granddaughter, because whatever is bad for your daughter-in-law is also bad for your granddaughter. So that's where the real dangers are. Kudos to her for listening to the experts and going ahead and getting the vaccine. That's the best thing she could do for herself and for your granddaughter while she's pregnant. There have been over 30,000 women who have either gotten the vaccine in pregnancy or who conceived shortly after getting the vaccine. So the data that we're collecting is very robust. And we have to remember that the COVID vaccine isn't COVID. They're not injecting a live virus. You're not getting COVID. So there's no danger from COVID, from acquiring COVID from getting the vaccine. So that's good. And so the data that we're collecting has shown no sort of dangerous effects from the vaccine in pregnancy, including no increased risk for miscarriage, no increased risk for preterm labor, no increased risk for birth defects, no increased risk for preeclampsia, or any of the things that we could worry about potential negative vaccine consequences.
And we're getting a lot of questions being fired off. I want to get to one, and then I want you, Dr. Brown, to give a little backstory of a recent patient that we came to know of as well. So first off, Angela's asking, does the vaccine keep you from getting COVID? So we want to address that. But also, Dr. Brown, if you can tell us what the worst case scenario is for a mom who does not get the vaccine, does contract COVID sometime getting close to her delivery date.
All right. So the first question, does the vaccine keep you from getting COVID? So the answer is yes. But sort of, right? The vaccine significantly decreases your chances of getting COVID. So obviously we've all heard of people who've tested positive for COVID after getting the vaccine. So we know it's possible to test positive, but you're less likely, significantly less likely to test positive for COVID after if you're vaccinated than if you're not vaccinated. So yes, it provides protection from getting COVID. The second, and probably more important, is it provides protection from getting severe illness. Severe illness requiring hospitalization, which may involve an ICU stay, which may involve intubation, which may involve dying from COVID. So that's the real benefit of the vaccine is while it does significantly decrease your chance from getting COVID, it decreases your chances from getting a severe COVID illness. The second part of that question
was about your recent patient and what the worst case scenario can be if you get COVID toward the end of your pregnancy.
So the worst case scenario, and I'm not in the business of fear mongering. I'm not interested in scaring anyone. And if it sounds like the information is scary, that's just because it is. But that's not my intention. It's simply to educate, right? So volunteering time to educate. So the worst case scenario from COVID for anyone from COVID is dying from COVID illness. Almost 700,000 Americans have already died from COVID illness or COVID disease. So that is the worst case scenario. So pregnancy increases your risk for having severe illness from COVID. So pregnancy is one of the risk factors. We know asthma is a risk factor, diabetes, obesity. Those are all risk factors for getting severe illness. Pregnancy is also a risk factor for getting severe illness. So at any point in pregnancy, if you get COVID, you could get severely ill, meaning hospitalized, meaning intensive care stay potential, meaning potentially dying. That's all possible. And regardless of when you get it. So my recent patient got it at 38 weeks. So she was full term. So she had already pregnancy-related sort of decreased respiratory function. You add COVID on top of that, and she had a very complicated hospitalization and stay involving an intensive care unit stay. So fortunately, she's doing well now, but that significant or severe COVID illness that she experienced is entirely possible regardless of when in pregnancy you contract COVID, but especially if near the end.
Well, and the important part, Doctor, too, is in her case, you had to go in to do an emergency C-section because she needed specific drugs in the protocol to save her life that you were worried about giving her that while she still had the baby.
Correct. So, the silver lining, one of the silver linings in her story is she was 38 weeks. So we were able to deliver her to improve her chances of surviving from COVID. And we didn't have to worry about prematurity with the baby because she was 38 weeks. So her daughter did very well after delivery. The medication that's often used to treat COVID, there's unknown. Those are folks. A lot of people through misinformation like to say the vaccine is experimental, while which it is not, while neglecting to point out that the treatment for COVID is experimental. That's what's experimental. And if someone gets COVID at 20 weeks or 18 weeks or 22 weeks, at some point before you're able to deliver the baby and have the baby survive, then they're going to be the doctors are going to be trying to save the mom's life, and she's going to be getting treated with the convalescent plasma and the remdesivirs and those sort of COVID protocols. And those don't have significant pregnancy data, so those are experimental. So the alternative to getting treated with COVID while pregnant is worse than getting significantly than getting vaccinated while pregnant.
And Lucas had a good question, saying I'm 29 weeks. Is it dangerous to get COVID? I'm assuming that she means, is it dangerous to get COVID vaccine this far pregnant? Is it recommended this far, basically third trimester? Is there a better time during pregnancy to get the COVID-19 vaccine if you're weighing that as an expecting mom?
No, you can get the vaccine at any point during pregnancy. Some providers, out of an abundance of caution, will tell you to wait till the second trimester, but you can get the COVID vaccine at any point. And getting it at 29 weeks is perfectly okay to do. And especially with what's currently happening with the Delta variant and how infectious it is. And if you live in Florida, where the viral load is so high because there's so many unvaccinated people and so many COVID positive people, we represent 20% of all the people who are testing positive in the entire country are coming from our state of Florida. All the people being hospitalized, all the people dying, 20% are all coming from our state. So the viral load in our state is very high. So some protection is better than none. So 29 weeks, get your vaccination regimen started. That would be perfectly fine.
Dr. Jess Decker had a comment as well that I wanted to address. She says she just had COVID 2 weeks ago, being 4 months pregnant. She says she has not had the vaccine, and her worst symptoms were restlessness and lost smell and taste for a week. She says she will not be getting the vaccine. Too many effects to your body. Can you talk a little bit about that and the fact that not everybody who is pregnant who gets COVID will develop symptoms? Same thing as the vaccine. Not everybody who gets the vaccine while pregnant is going to feel the effects of the vaccine. If you can kind of elaborate a little bit on what the situation is.
Well, I mean, COVID is unpredictable. Most people who get COVID survive. Many people. Most will not have long COVID. The overwhelming majority won't have long COVID. They won't be hospitalized. They won't go to the ICU. So that's wonderful, right? But it's unpredictable who will have severe symptoms and who won't. Having had COVID and not having severe symptoms or having very mild symptoms is pretty typical, and that's great. And not having any long COVID symptoms, that's wonderful. Having COVID, however, in the past doesn't give you full protection. The data is saying having had the alpha variant in the past doesn't necessarily protect you from the Delta variant. Having had it 4 months ago, I'm not sure what variant she got, but a vaccination would still be recommended for her to protect her for the remainder of pregnancy and after pregnancy. Obviously, she said she's not going to get the vaccine, and she's pretty clear about that, and that is her choice to make. But if the question is, should folks who've had COVID in the past still get vaccinated? The answer is yes.
And Nicole has a question. Is it true that the COVID vaccine does not cross the placenta, and how does that work?
The COVID, so we have to remember, the COVID vaccine does not give you COVID, right? So it's the science of it simulates it. So it's not a live virus. It's not a live vaccine that attacks you. It does not cross the placenta. It tells your body to generate antibodies, so that to be prepared to face an outside threat. And if you are exposed to COVID, you will generate antibodies to fight off the infection. Some of those antibodies can cross the placenta, which is fine. The antibodies aren't harmful. And I don't know what the data is on vaccinated women delivering, what percentage of babies have been tested and whether or not they have antibodies or not. That data hasn't come out yet, or I haven't seen it. But if the vaccine isn't crossing the placenta, it is the antibodies that are generated may cross the placenta.
And I want to ask a question just to clear this up. For a lot of women out there who say, well, I'm healthy. I think I can fight off COVID on my own and don't want to get the vaccine and don't have any underlying conditions. Doctor, once you become pregnant, does your pregnancy become an underlying condition?
It does. The pregnancy becomes a pre-existing condition, so to speak, or what the correct way to say it is, it becomes a risk factor for severe COVID illness. There are a few things that happen physiologically in pregnancy. One is that the immune system gets naturally suppressed, so that your body, your own immune system, isn't attacking the developing fetus or the developing baby. So, and as far as a respiratory illness goes, the further along you are pregnant, the greater the decrease you have in lung capacity and lung volume. So your respiratory function naturally decreases during pregnancy. So you have a greater tendency to form blood clots in pregnancy because of the change in the components of your blood. So given all of those things, and more, pregnancy becomes a risk factor for severe illness with COVID naturally, even without doing anything else. If you look at your risk factors prior to pregnancy and your risk factor while pregnant, you are more likely to have severe illness just by being pregnant.
And if you all missed the story we showed earlier, Kenya Kaska is a local mom in Lake Worth who got COVID during her pregnancy. And doctor, you might also be able to confirm this with the majority of patients. If you go to the hospital and you're pregnant, unless you have progressed to severe illness, there's really nothing they can do for you. They send you home and tell you to take, I guess, Tylenol or whatever the case is. I mean, what happens to pregnant women in those conditions?
Pregnant women with mild symptoms are treated no differently than non-pregnant folks with mild symptoms. If your symptoms aren't severe enough to require hospitalization, then you're discharged home with supportive care. If they're, so like you said, Tylenol, hydration, that sort of thing. If they're worried about an underlying a superimposed infection, pneumonia, they may send you home with some antibiotics as well, or prescribe antibiotics. But if your symptoms are pretty mild, yes, you are sent home to sort of convalesce or recover at home.
There was also a question on here I wanted to get to. Christy Wolf asked, is it true when you get the COVID vaccine, when you breastfeed your baby, you will get the antibodies, or I guess she means you will pass on the antibodies for COVID? What is the studies on that? Is there any truth to that?
I haven't seen data specific to that. It's not a faulty assumption to make that a breastfeeding mom who has been vaccinated or who has had COVID and has circulating COVID antibodies in her blood would pass those on to a newborn while breastfeeding. So yeah, just like one of the many benefits for breastfeeding is immune protection by passing on antibodies to the baby. It should be no different with COVID antibodies.
And what data is out there? Dr. Kelsey wants to know, how do you know what the lasting effects are for you or your unborn child if you get the vaccine?
So the way the vaccine works is in effects that's months or years out, and the COVID vaccine is no different. The people who have severe vaccine reactions, such as an allergy or a neurological condition called Guillain-Barré, those tend to happen within the first 4 to 6 to 8 weeks of getting the vaccine. And that's because the components last in your system for that long, and then they break down significantly. So I said all that to say that the premise of the question is faulty because it assumes that the vaccine material stays in your blood for years and can cause an effect to you, or stays in the baby's blood for years that can cause an effect to the baby. And that's just not how the science of it works. So if you are going to have a reaction to the vaccine, usually the mom or the person receiving the vaccine would have the reaction, and it usually is within the first few weeks of getting the vaccine.
And what is the percentage risk of those who have developed those scenarios you mentioned, Guillain-Barré or any other?
Guillain-Barré is extremely rare. I mean, it's clearly less than 1%. I would have to look it up specifically to see how low it is. It's a potential side effect from really any vaccination, because the vaccines work by telling your immune system to turn on and be ready to face threat. So they generate an immune response, and with Guillain-Barré, it's an immune response that has gone significantly out of control.
We've had a couple questions, and I can't find the exact one. Oh, just found it. Austinique, I have heard rumors that the vaccine causes infertility or miscarriage. She's asking if this is true.
That is, it's equivocally untrue, and it's one of the more persistent pieces of disinformation that have existed about the vaccine, and it has prevented many women of childbearing age from getting the vaccine. Even women who work in healthcare have not gotten the vaccine because of that rumor. Someone took a very sciencey sounding word or protein that sounded very similar to a protein that's in the vaccine, and that other protein, which wasn't the same, was linked to infertility in placental implantation, and they put a whole bunch of fancy words together and linked them and put an article out when the vaccine was released, and that has stuck. You have a healthcare personnel who think that's true. You have a large part of the general population who think that's true. It is unequivocally false. The COVID vaccine has no link to infertility. The Society for Reproductive Medicine, or the infertility docs, the Society for Obstetrics and Gynecology, and the Society for Maternal Fetal Medicine, or high-risk obstetrics, they all have come out unequivocally to recommend the vaccine and state there's no link with the vaccine and infertility. And
we have some data as well, right, from the vaccine trials of women. Do you have that information, doctor, of how many women in the vaccine trials got the vaccine not knowing that and then got pregnant afterwards, or any data like that?
So the latest I heard with it, which is several weeks old now, that there are at least 30,000 women either got the vaccine and conceived shortly afterwards, or got the vaccine in pregnancy. So there isn't specific data that I have at my disposal that shows that people who are getting the vaccine are able to get pregnant right away. But we know that people who are getting the vaccine are not having difficulty conceiving. That is related to the vaccine. So if someone was going to have difficulty conceiving from before the vaccine, or we're having difficulty conceiving prior to getting the vaccination, the vaccine's not going to change that. That difficulty or infertility is going to remain. What's not going to happen to the vaccine isn't going to be the reason why someone is unable unable to conceive.
Is there any data right now, or what is your recommendation? What kind of, in what scenarios should pregnant women or women who are trying to become pregnant not get the vaccine?
Well, if you have a medical condition that says that you shouldn't get the vaccine, and that's something for you to discuss with your individual providers, whether it's some sort of vaccine allergy, whether it's a specific autoimmune issue where the vaccine is contraindicated, those would be reasons not to get it. And that's pretty much it. The advice to people who are saying, all right, it's time to try to have a baby, I'm ready to try to conceive. The advice isn't get the vaccine, wait, and then try to conceive. You can get the vaccine while trying to conceive.
There was a comment on here I wanted to ask you about, Doctor. I'm not familiar with it, but Julie says check the VAERS database. Almost 1,900 unborn babies have died associated with the vaccine. Do you have any knowledge of this?
Yeah, no, that's just misinformation. We can move on.
Okay. We'll look into that. And also wanted to ask you, someone wanted to know if once they got, I'm trying to find the question right now. So once they got COVID and they went through COVID pregnant, how soon after should they get the vaccine after delivering?
That's up to them. They can get it the day after delivering if they want to. It's safe to get at any point during pregnancy or after delivery.
Okay. Anything else you would like to add, Doctor, about, the risk that you get as you progress in your pregnancy if you do contract COVID? I know you mentioned earlier that there are a lot of women who may have had COVID prior to pregnancy last year, and now we're dealing with different strains of the virus, different variants. How does the variants impact your potential for reinfection?
Yeah, so the current surge of COVID cases, the sort of our current crisis has sort of made us it's awoken everyone up to the fact that vaccination is what will sort of offer us the best protection. And for pregnant women, it's understandable the concern about safety and about protecting the baby is your number one responsibility. So being sort of leery or cautious is understandable. But the point I made earlier, I'd like to make it again, is that all the scientists that have spent their lifetime working on this sort of information have agreed that the vaccine is safe and effective. So the questions about safety are good questions, but those questions have been answered. The vaccine is safe and effective. It is safe and effective in pregnancy, yes. Those questions have been answered. The experts have spoken. The people who have done the clinical research have answered that question. The other question is, well, what about COVID? How dangerous is COVID to pregnancy? And we've had 18 months worth of data that has also answered that question. So we know COVID is potentially dangerous in pregnancy. We know pregnancy puts you in a high risk category at any point in pregnancy, but certainly as your respiratory function decreases, so to speak, as you get further along, you could get an even more severe illness. So we know the vaccine is safe and effective. So knowing all that, our focus is education and making people aware that COVID is the demon in this whole scenario. The COVID is the one that has more unknowns and more dangers by far. It's not even a fair comparison than the vaccine.
And I just want to address something that keeps on popping up here. Dr. Brown, how much are you getting paid to do this interview right now?
Yeah, I'm not getting paid. I mentioned earlier that I'm volunteering my time.
Exactly. And I don't know what your employer pays you, but I can guarantee you that what I'm asking him, we did not prep anything. He's just answering questions based off of his knowledge.
Yeah, just volunteering my time. This is, to educate the public. If it's not what you want to hear, so be it. But for those who are here to learn, to listen and learn, based on knowledge, experience, and education, that's what we have.
And I just want to go back to again, and Doctor, you have said this many times, at the end of the day, it is a personal choice what you decide to do. And I'm sure you have these conversations all the time with your patients.
Yes. Everyone has to make that choice for themselves as to whether or not it's one of millions of choices you make, either while pregnant or as a parent, right? Because our focus is protecting our children. As a provider, as a physician, our goal is to provide you with the best possible information to guide you through pregnancy, as an obstetrician, to guide you through pregnancy with the best possible information, and to safely deliver your baby. So part of what we speak to our patients about is evidence-based scientific information that has data that's behind it, and we say, this is what we recommend. You get to choose. And right now we're in the middle of a public health crisis, so we're having this specific conversation. But yeah, we educate patients, we make recommendations, we don't beat people up or tell them that they're bad people if they don't do it, but we educate, and they get to decide what they want to do.
Thank you so much for your time, Dr. Brown. I really appreciate it. And again, I think the biggest thing here is talk to your healthcare provider and decide what's right for your family, what your risks are, what the benefits are. And I'm sure we've all been doing that during the pandemic. So I think people took what they needed to know out of this conversation. I appreciate your time, Dr. Brown.
You're welcome. Thank you
so much for the great questions and comments.